Welcome to our latest Public Health Conversation Starter. This is a series of conversations we are having with thinkers who provide a critical perspective on the work of public health. Today, I have the privilege of being joined by a very special guest, Congresswoman Ayanna Pressley. Congresswoman Pressley has served as U.S. Representative from Massachusetts' 7th Congressional District since 2019. Prior to her election to the House, she served as a member of Boston City Council. Since she's been in the House, Congresswoman Pressley has been one of the strongest, clearest voices for health in the House. I'm really delighted to be speaking with Congresswoman Pressley today. Thank you for joining us.
Thank you for having me, Doctor.
Let's start with just perhaps a sort of easy question. Can we just talk a little bit about your background and how you came to choose a career in public service?
Sure. Well, I was raised in Chicago in a single-parented home by a mother who was a community builder and a community organizer and activist, and a super voter. And she took me with her to vote in every single election. And she also spoke with me very plainly about what she saw as my responsibility to do the work of liberation, the liberation of Black people and all marginalized communities. If I want to start at the beginning and make it about my origin story, it was definitely about my first teacher, who was my mother. A parent is a child's first teacher, and I had an extraordinary one. I would also say that being proximate to a lot of disparities, I had a lot of questions about why that was. And once I had an understanding that was as the consequence of policies, mostly federal policies, and of systems and structures that really motivated and emboldened me to want to do the work, not only of public service, of movement building, but specifically of advancing policy that would undo the harm of well-meaning legislation with unintended consequences, or of discriminatory and draconian policies that had contributed to disparate outcomes, majority and low income, and communities of color.
Well, that leads us very well to the first topic I want to talk about. I want to talk about COVID for a second. We're talking about health. It's inevitable that we talk about COVID. Let's start off by, what do you think public health did well, and what do you think public health did not do well during COVID?
Well, I mean, many people have spoken about how the pandemic did shine a light on many inequities and disparities. Certainly, I knew anecdotally, representing one of the most unequal congressional districts in the country and the most unequal in the Massachusetts delegation, including and especially when it comes to health outcomes, that my district and these communities would be some of the hardest hit. Because they are ecosystems where people are struggling to survive, forget about thriving, with unequal access to healthcare, disparate exposure to emissions, highest asthma rates, unequal access to fresh and healthy food. The confluence of those layered inequities, again, resulting in some of the most disparate health outcomes. I think that those communities anecdotally would be the most vulnerable to rates of COVID infection. And consequently, myself and Senator Warren partnered and introduced the Equitable Data Collection Act. And I believe this did save lives. Although our legislation was not passed wholesale, the key tenets of it were passed, and that was to mandate that the Center for Disease Control collect, disaggregate, and report in real time racial demographic data. Prior to that, when it came to COVID rate of infection, hospitalization, and fatalities, they were only collecting age and gender. And so what they did do right is that they released that data. And so it was already making us aware of, again, anecdotally, those trends and the disparate impacts of how this was playing out that we could have anticipated, but we needed to know more. And so I'm grateful that they were responsive. And once we had that data, then we could do the work of ensuring that the federal resources were being stewarded in a way that we were getting it to the hardest hit and those communities in the greatest need. what I hope now is that we've learned the lessons. It's not enough for those inequities to have a light shined on them or shown on them. Sunlight is certainly the best disinfectant, but then what are you going to do about it? It's not enough to just say the pandemic shone a light and exacerbated those inequities, but now what? We can't default to an unjust status quo. We have to chart a different path forward. And, as I said, once I realized that many of these inequities were shaped because of federal policy, um, that is why I say policy is my love language. And I want to legislate in a way that undoes that harm and charts a different path forward. And that's why myself and Congresswoman Barbara Lee then introduced the Anti-Racism in Public Health Act to address the systemic and embedded racism within our healthcare system. And I continue to fight to make sure that our community health centers and other healthcare providers are fully resourced, especially our CHCs. I represent the highest number of community health centers of any congressional district in the country. I have 15 in the Massachusetts 7th. So 1 in 3 of my constituents receive their care from a community health center, and they treat our most marginalized. And they do that with a patient-centered approach and one that is culturally competent and humble. And they also have a healthcare workforce and providers who reflect the diversity of the community. And that's very important because very often, because of a lack of cultural humility and competency, because of a healthcare workforce that is not diverse, very often important symptoms and indicators go unnoticed. If you look at the Black maternal morbidity crisis, that's one such example where the pain of Black women is minimized or delegitimized entirely. And so even when a Black woman, regardless of socioeconomic status, is saying, no, there's something wrong, there's an unwillingness to listen. But we're making strides both in the Black maternal morbidity crisis, and I think there's been a lot of truth telling since the pandemic, especially about the racism within our healthcare system.
Well, let's talk. I like that phrase, truth telling, for a second. And you and I have discussed this before about the fact that since the pandemic, I mean, it's hard to even use the word of blessings in the context of a tragedy like the pandemic. But one of the blessings is that we're talking about things that before were hard to talk about. And certainly racial, ethnic inequities in health is one of those things we're talking about more. Now, for you and I both understand it's sort of second nature to us that housing and income and community safety matter for health. But it's such a difficult message to get the general population to understand and elected representatives to understand. So I'm just curious about now, having been in Congress for these many years and trying to persuade your colleagues, how does one get the message across that health is not just medicine, it's not just pills, it's not just doctors, not just nurses, but actually it is about where you live, the air you breathe, the water you drink, where you live, having sustainable wages. How do we get that message across?
We have to be vigilant with it. For example, when we introduced the Anti-Racism in Public Healthcare Act, I think first, anytime you embed race in something, including in the titling of a bill, there are those who immediately shut down because they think that you are indicting them in some way. This is not an indictment of any. We're grateful to our first responders and healthcare professionals and doctors, of course. This is about systems, things that are so embedded, so structural, so institutionalized that you're unaware of your bias. It's not always as demonstrative as you are Black and I refuse to see your pain. It's about the education that people have received. When it comes to people understanding the holistic health of community, that's something that has been a personal mission of mine. Prior to serving in Congress, I served on the Boston City Council for 8 years, and I created a standing policy committee there, the Committee on Healthy Women, Families, and Communities, to underscore the ways in which the health of the individual, family, and community are inextricably linked. And it is about a total ecosystem, which is also why we have to support and treat the whole individual. And so one of the things that I seek to do always is to lift up the voices of those closest to the pain. I believe that people closest to the pain should be the closest to the power, driving and informing the policymaking. And so, what I do in making appeals to my colleagues or um, to agencies, to the administration, I make sure that any bill that I write, any vote that I cast, any bill that I co-sponsor, that I'm not doing that without actively engaging those closest to that pain. It allows us, by being proximate, to understand the intersectionality, the complexities, the nuance. But it's also where we harness our best innovation and solutions to these challenges. And also, the data is undeniable. Healthy housing uh, is a critical determinant of health. And so we have the data that supports that. We know that communities that are proximate to highways have higher rates of asthma. We know that when people cannot access fresh and healthy food, they are left with no choice but to eat a lot of processed food, and that results in diet-related diseases. I think it's just constantly highlighting the intersectionality of these systems, which has resulted in a marginalization and oppression and disparate health outcomes. Um, I think ultimately our greatest wealth as a nation is the health of our people. And I do think that the pandemic laid that to bear as well. And I'm also leading on the issue of long COVID, and introduce legislation, the Treat Long COVID Act. I do a lot of work in the disability justice space, and there were many disability justice advocates who feared that COVID would be a mass disabling event. And on its face, that should be enough to get people to pay attention. But when people started to really pay attention is when they saw how it was affecting workforce
Mhm.
and our economy and the GDP. And that is so often the case.
I have so many questions, but I'm disciplining myself. Let me ask a question first about our divides, because you made a really interesting comment, which I value. Where you said, you do a bill with the word race in it, and you're instantly having some people shut off, which I think captures some of the divides in the moment we're in. And we can discuss why the moment it is, but it is what it is. How do we bridge those divides? What are key points that you have learned in your time as a legislator, as a policymaker, to bridge divides to the end of generating positive action, but also not compromising on one's core beliefs?
Well, first, I just want to, clarify that it is not only those that you might naturally assume in the midst of great polarization and culture wars that would shut down with racism in the title. It's even for some of my friends and closest allies, because again, it feels like um, people can process it as an accusation.
Interesting.
And it is not an accusation. We're talking about data and science and fact. But anytime you embed race in something, it people get defensive. And I think because they feel that there's an accusation being made at them, but we're talking about things that are so systemic, so pervasive, so institutionalized that usually there's a bias that you're completely unaware of. I have been the first a number of times in my life. I was in the minority as a aide to United States Senator John Kerry, in the minority as an aide to Congressman Joseph P. Kennedy II. I was the first woman of color, a Black woman elected to the Boston City Council. That only took 100 years. And I'm the first person of color, first Black woman to serve in the House of Representatives representing the Commonwealth of Massachusetts. And that only took 230 years. The thing about having a diverse representation in government, a diversity of perspective, opinion, and thought, is not so that we can applaud and commend ourselves for progress made. It's not for contrived moments of kumbaya. It's not for more diverse pictures. It's because when you have a diversity of perspective, opinion, and thought, people are going to call different questions because they're bringing the totality of their lived experience. And so this is, I believe in order to change hearts and minds, in order to change policy, I have to change hearts and minds. And the way that I do that is to bring the totality of my lived experience, just to do that truth telling, to tell my story. If the issues being raised, doctor, and the solutions being cultivated are only through a monolithic and homogenized prism, then that does a disservice to everyone. And that is the true power of a representative government that reflects the citizenry that we have the honor of serving.
The phrase "to call different questions" is a terrific phrase. I'm going to remember that. Thank you. I actually think that was really a perfect
Yeah.
description of the
And
importance.
it's always, and I'll give an example. When I was elected to the Boston City Council as the first woman of color to serve on that body, our first budget cycle, every agency that came before me, I asked them, what about the girls? Because it had been my experience that the discourse was so dominated about how Black and brown boys were at improving risk. But I really believed firmly that we needed gender specific and responsive programming and policies to meet the needs of girls, and that was the role of government. But they had monosyllabic answers the first budget cycle, Dr. Galea. They and then by the second budget cycle, they came with cross-tab multicolored binders because they knew someone was going to call the question. And again, that is the power of representation.
That is fabulous. All right, I have two more questions. First,
Okay.
different question. I've been intrigued by your tour with Senators Warren and Markey on Supreme Court reform. And I was wondering if you can actually comment a little bit of, I have a hard time within health space pushing the ideas about how much things like the way courts function matter for our health. I was wondering if you can actually tie your work on that with this conversation.
Sure. Well, whenever people say to me, I'm not political, you're more political than you realize, because every single thing, this restaurant that we're sitting in was permitted. The cocktail that you're having there was a license. The crosswalk was determined. I mean, politics, political policy has shaped and determined everything in your life. Who you vote for determines who's elected. Who's elected determines the policies, and the policies determine who lives. The policies determine who dies. The policies determine who survives. The policy determines who thrives. If you need any evidence of that, you merely look at our Supreme Court, and it's my opinion, and perhaps this is a nonpartisan platform, but you've invited me, so I'm going to be myself. I do believe that there are extremist MAGA Republicans for whom the lower courts and all the way up to the Supreme Court have become co-conspirators and accomplices in their extremist agenda, which, by the way, runs against the grain of the will of the majority of the people on everything from voting rights to housing rights to gender affirming care for our LGBTQ siblings, to access to abortion care, which is health care, whether you're talking about managing a miscarriage or ectopic pregnancy, or just the freedom over your own body. And right now, the Supreme Court, the highest court of the land, which should not be legislating from the bench and should not be a partisan proxy for any party, Democrats or Republican, is operating with an imbalanced and far-right extremism that is damning. We are just finding ourselves in very unprecedented times. I mean, when you look at, and thank God ultimately that there was a ruling in our favor on mifepristone and medication abortion there. But imagine the slippery slope of the courts, who are not doctors, suddenly being able to overturn not only the will of the people, but decisions made by the Food and Drug Administration. So all of this is political, and or all of this is policy. All of this is connected, and it is relevant and impactful to public health. And we've seen that happen in the most draconian and dangerous ways right now, but it's true for every decision. And so I think that for people at the highest court of the land, although we don't elect them, for people at the highest court of the land and lifetime appointments, there have to be some ethical standards. So I thank Senator Warren for legislation she's introduced. They should not be able to be influenced by anyone, certainly not bought. And then secondly, we need to expand the courts. We need to reform and expand the courts. And I'm a part of legislative efforts in partnership with Senator Markey to do exactly that, to address the far-right extremism and imbalance of the courts, to restore legitimacy, to restore balance, and to restore fairness.
Thank you. All right. Now for real, two last quick questions. Number one,
Okay.
advice for the younger generation on how to create a better world.
Well, it's probably a little hokey, but it's just my belief system that the most political thing that you can do is to be a good person. I'm a believer that there is no deficit of resource. There is a great deficit of empathy. And so the most political thing you can do is to be a good person, to see us all as, in the words of Mel King, he said, we are a country of neighbors. We are all neighbors. And I believe we're one human family, and our freedoms and our destinies are tied. So you have to see a stakehold, not only in the challenges of your neighbor, but in their dreams as well. Of course, vote, be an active citizen, vote in every election. Every election matters. Again, that has been confirmed in recent years, especially so. Every office matters, from Secretary of State to mayors, to school committees, to governors, and certainly to the federal level. So vote in every election. So be a good person. See us as a nation of neighbors, as one human family. Our freedoms, our destinies are tied. Vote in every election, and practice the discipline of hope. I am a voracious reader, mostly of poetry, and I also love affirmations and the practice of them. And there's a dear sibling of mine in the work of justice who gave me an affirmation that I return to every day, and it's that I choose the discipline of hope over the ease of cynicism, and I choose fortitude over fatalism. I choose the discipline of hope over the ease of cynicism, and I choose fortitude over fatalism. It's such an important and necessary reminder that hope is not something that just organically occurs. It is a discipline. And so if you can practice that, you will be on path to making the world a better place.
That's not hokey at all. I think this is quite beautiful. The most political thing you can do is to be a good person. And of course, you completely anticipated my last question, but I'm going to ask it anyway.
Okay.
What is it that gives you hope in the moment? This is building on what you just said.
I am 49 years old. I worked on my first campaign at the age of 10. I have been doing the work of electoral politics and movement building professionally since I was 19 years old. I am restored and emboldened in my hope by this next generation. They do not have a high tolerance level or threshold for injustice, and they are showing up on the front lines of movements and at the ballot box. Last night, maybe this is evergreen, so I shouldn't say this, but recently I attended the White House Correspondents Association dinner. And so you have luminaries and influencers and celebrities even, but the longest line at that dinner for people waiting to meet them and to take photos were two of my little brothers in the movement. And those are state representatives, Justin Jones and Justin Pearson from Tennessee. Again, who stood up and risked permanent ousting despite being duly elected in a democratic process to that body, and risked, sadly, even the disenfranchisement of their constituents. But they protested and participated in dissent and violated decorum with righteous indignation because of the public health crisis that is gun violence. And I said, they're striking a resonant and deep chord because in the words of Angela Y. Davis, I'm no longer accepting the things I cannot change. Instead, I'm changing the things I can no longer accept. And I do believe that that is sort of the urgency and the frame with which many Gen Z are operating when it comes to racial justice, climate justice, when it comes to gun violence. They feel a sense of entitlement, thank God, to a future. And they're willing to do everything to ensure that they have one. And they have seen up close and personal decades of policies that have failed. Prior generations and their parents and society writ large. And they're not here for it. So, I mean, when I think about her name escapes me right now, unfortunately, but the transgender lawmaker out of Montana also similarly, righteous indignation in the face of injustice. So that's what gives me hope. This generation is giving me a lot of hope about our future because they are unapologetically righteous and vigilant in the work of seeking justice, and they're not afraid to tell the truth.
Congresswoman Pressley, thank you. You have succeeded in sprinkling throughout this conversation all these aphorisms, which I need to go back and listen to and make sure. Thank you for everything you do. It is always a privilege talking to you, and it's really a privilege to have you representing us in Congress. Really, thank you.
Thank you so much. And I'd be remiss if I did not acknowledge the outsized role that Boston University played in my life. Coming here in 1992 from Chicago to attend Boston University, not knowing a soul. And it was at Boston University and, of course, the city of Boston, which refined and crystallized my purpose and changed the trajectory of my life. And for that, I am exceedingly and eternally grateful.
Thank you, Congresswoman Pressley. Take good care. Thank you for everything you do.
Take good care.